Hi and welcome to another training video. My name is Sofia and I help people with lower back pain, correct muscle imbalances and postural misalignment, as well as reduce inflammation naturally through nutrition. And in this video, I want to help you get really clear on what's triggering your pain on a daily basis. I want to take you through part of the process I take my clients on to really pinpoint the root cause of their pain, what's triggering it every day. And the reason why I can only take you through part of the process is because the second part is very specific to the individual. It's different from person to person, and I would have to see you to really do that assessment. But this first part should be enough to at least lead you in the right direction to finding all of those habits or unconscious or conscious movement patterns that are causing or contributing to the pain on a daily basis. And I've also created an assessment guide for you to print out so that you can go through the exercises with me on this video, and for you, of course, to review if you'd like in the future. But go ahead and go on the blog at coachsofiafitness.com/11. The link is also here, and I will put also the link below the video, so you can head to the blog, you can print it out, and you can do the exercises after the video as well. But it's really important to review assessment questions every 3 months, and also redo the assessment to see if there were any improvements or if there were any new things that you want to add. So the first part, we want to assess your occupation, or if you're just a stay-at-home mom, you can also assess all of the activities that you are doing on a daily basis. So the first thing we will be looking at is, of course, periods of sitting. Does sitting occupy a large portion of your day? Are you driving a lot? Are you sitting a lot on your desk? And if so, for how long until you take that next break? Because if you're sitting for too long, that can translate into having really chronically tight hip flexors that cause muscular imbalances. It's just a natural thing. When you have really tight muscle, they will cause some postural changes. And if your job requires you to be sitting on a computer for longer periods of time, again, that will translate into rounded shoulders, forward head posture. So when you look at the things that you're doing on a daily basis that could be contributing to the postural changes that are also contributing to the pain. The second thing to look at are repetitive movements. So as your job or the things that you're doing on a daily basis include any repetitive movement patterns, because those will start overloading the joints, the muscles, and that would create tissue damage, again, postural changes, and certain examples of activities are things like painting, or if you're working in construction jobs and you have to be lifting your hands and your arms overhead for extended periods of time. Or for example, if you're doing the dishes and you have to look down and round your shoulders for long periods of time every day. So look at anything where you're doing too much of every day. Be it sitting, standing, activities like doing the dishes or your activities at your job, and look at any repetitive movements. The next thing is, of course, what type of shoes you're wearing, especially if you're standing too long, or if you wear high heels at work. It's really important to look at if you wear them every day, because that will cause some postural changes again. So are your shoes providing enough support? The other thing we want to look at is your mental state, and how stressed out you feel, either at your occupation or your normal life in general, because your mental well-being and how stressed out you are affect your muscle. You have no idea, guys, how many flare-ups I've had just by being stressed out, like really bad flare-ups, and I knew exactly what caused those. And at the moment that I would have some time off or go on vacation, I would get better. I did a whole video about how stress affects muscles, so I'm going to link that video, but it's really important that you go ahead and watch it. And when I'm saying stress, I'm talking about little things like stressing out about bills, stressing out about because of traffic, or just the little things that you go through all throughout the day, in addition to the big stressful events that happen that really takes the toll on our nervous system. And then the other part is we also want to assess your hobbies, the things that you do for fun, and look for any potential muscle imbalances there. For example, people who play certain sports could develop some muscle imbalances playing those specific sports, or certain people go to the gym but they don't know how to lift properly, so there are things that could be going on there contributing to their pain. Or even things, for example, like working on your car, right? Like you love working on your car, and then you know that you get pain every time you do that, but what you don't know is that you're always bending forward wrong, like you're putting a lot of pressure on your lower back when you do that, you don't take enough breaks, you don't brace your core. So just things that you do, like gardening, playing tennis, again, working on your car, that could be causing pain without you knowing. So just brainstorming all of those activities and looking at possible areas where there could be some muscle imbalances or postural misalignments happening there. And of course, you want to look at your medical history. If you've had any surgery before, that could be affecting how you're feeling right now, because all of those things can affect your movement patterns. And if you did have a past surgery, did you go through full rehabilitation? So a lot of people, when they don't do that, then they start walking differently, they start doing things differently. They don't really learn how to move properly after that injury, and that causes new muscle imbalances to develop and new injuries to happen. So it's important to understand how to teach your body how to move properly, especially after you've gone through surgery or if you've had an injury. And also in the process of compensation, right? So when you're at the gym but you don't really know how to lift properly, or it hurts to do certain movements, so what you do is you push yourself, but then you start getting other little muscles to come and help, and having them compensate and create more imbalances that way. But believe me, when you do this exercise, you will be able to notice many patterns, especially if you've noticed that you always feel better or worse on certain days, certain times, when you do certain things, that you can pinpoint exactly the type of activities that are causing those things, and you can notice, okay, what am I doing here that I'm also doing here? What is, what's in common? You can literally see if it's a posture, if it's a movement, if it's a load, right? When you pick a certain weight, you feel pain, but when you go grocery shopping and you pick the same weight, again, the same thing happens. So you can start noticing these things happening. So when I'm working with my clients, we do this first step, and then the second step is really working on identifying those muscle imbalances, fixing those muscle imbalances, and then teaching them how to move properly to avoid further imbalances. So that way you're able to do things and you know how to do it without triggering the pain. It just gives you a lot of confidence in living your life normally, knowing that you're doing things right, you're not causing more pain. So if that's something that you're interested in, I will leave the link below the video. You can check out my coaching programs. But again, this first process is important. It will help you get really clear, because if you don't know what's going on, you will be repeating those things unconsciously. You'll just be doing them without knowing. And if you just, can't figure it out, you don't see any patterns, reach out to me over email. Maybe you can even scan your assessment guide and send it to me. I'll be more than happy to look it over and let you know what I'm noticing. And again, go ahead and download the assessment sheet at coachsofiafitness.com/11. That's on the blog, and you'll be able to get it there. I really hope that you got value from today's video. If you did, and if you know someone who may need this, please share this video with them. Comment below, let me know what you've learned, if you've learned anything new. And thank you guys for watching, and I will see you next time.